Good evening, ladies and gentlemen, dental enthusiasts and aspiring healthcare professionals. Welcome back to Coachminister. Today, we have the incredible opportunity to delve into the dynamic world of dentistry and nutrition with someone whose journey is nothing short of inspiring. Joining us today is a distinguished dentist with over 4 years of practical experience and a current pursuit in mastery in nutrition, the multi talented Dr. Anjana. Hi, Anjana, how are you today?
Hi, Aman. I'm good, thank you. How are you?
I'm great. I'm great. Anjana, so the people who are watching, I want you to quickly introduce yourself so that they get a little sneak peek into your life and all that you do.
Okay. Hello, everyone. Myself, Dr. Anjana. I'm a dentist. I'm currently pursuing, I'm in my final semester of my master's in nutrition and dietetics from Symbiosis University. So I'm also a mother of two kids. And yeah, so this is very much me in a very short brief.
Uh, One thing I want to tell you, Anjana, for a human being, that's a lot of things. That's a really lot of things. And kicking off the live session, before we jump into the specifics, let's rewind the clock a bit. And I want to ask you, Anjana, what inspired you to become a dentist? Was it something you always dreamt of, or something you discovered later on, but developed a great interest toward it?
Okay, so to begin off, see, it has always been my childhood dream to be a doctor. And there was a, incident in my personal life where, there was somebody very close to me who suffered a lot. And that is when, I decided that, yes, I have to get into medical field. And I'll say, frankly speaking, I wanted to get into MBBS when I gave my, entrance exam after finishing my 12th. But unfortunately, I didn't get into MBBS, and that is when I chose BDS as my second option. So I joined Government Dental College in Bangalore, and that is where I've done my graduation from. So, frankly speaking, dentistry was not my first choice. Okay, so but then I wanted always to be a doctor, and when not in MBBS, I took up BDS. That is how I got into dentistry. But once in dentistry, it has been an amazing journey. So I have loved every minute of my college days, and even during my practice, it has been amazing. So nothing less. I mean, I wouldn't just put it as a second choice now. I would say my love for dentistry definitely increased after joining college.
So, Anjana, you mentioned the entrance exam and the journey. So, I want to
Hmm.
know how tough is it to get into dentistry? The for now in current situation, it's NEET UG exam.
Yes,
What
correct.
is the difference between your time and now the current situation? Can you
Yeah,
briefly
yeah,
discuss about how
sure.
do people transition into colleges through the entrance exams and the struggles you faced in your time?
Right. So the thing was, when I gave my entrance exam, it was basically I gave a state entrance exam. It was called CET, Common Entrance Test for Karnataka State. I have done from GDC Bangalore. So it was like I gave a CET for Karnataka, and I got into GDC Bangalore. But we also had a lot of people coming in from the AIQ, that is All India quota. Then, right now, I think we have just the NEET UG exam, which is a common exam. We don't have statewide separate exams to get into dentistry or BDS or MBBS. I mean, any medical field for that, MBBS and BDS, you have to go through NEET currently. So, NEET UG exam is what you have to give right now. And once the NEET UG is cleared, you will have certain cutoff marks for the NEET UG. And once that is done, you can get into any choice of dental college or medical college, and you can pursue your degree. Aman, am I audible?
Hello, hello. Am I audible?
Yeah, you're audible now. I think there was a hang in between. But was
Yeah,
I
yeah.
clear when I was explaining?
No, no, no. I got a little hanged and everything stopped at once. So
Okay,
can you
okay.
repeat? Yeah.
Yeah, sure. So the thing is, when I entered my graduation, it was basically through the Karnataka Common Entrance Test (CET), right?
Yeah.
So I secured a rank in the CET, and through that I got into GDC Bangalore. But currently there is no separate state exam as such. You will have to give the NEET UG exam for getting into both MBBS as well as BDS degrees, and you will have to, fill up your preferences, college preferences, and all that. And depending on the availability of seats and depending on your marks and all that, they will allot a seat in the respective colleges. That is how you get into BDS or MBBS in the current scenario.
Anjana, I want to ask you about the challenges you faced while preparing for the examination. As you mentioned that you always wanted to get into MBBS, but
Yeah.
you got into BDS. So, what are the challenges a normal person who's transitioning into this examination of the entrance examination are facing, and what challenges you faced?
Okay. First of all, the preparation. I mean, you require a lot of preparation since NEET, as you all know, is, an extremely competitive exam where lakhs of people give the exam together. In my case, the Karnataka CET had lesser number of people definitely compared to NEET when the volume you add up to, but still the competition was neck deep. I mean, it was really tough competition. Any competitive exam for that matter requires a lot of preparation and all that. So in my case, my ranking was not really bad, but still it did not, it was not good enough to get me a MBBS seat. So I would say preparation early on when you're starting with your 12th itself or 11th itself for that matter should help you in cracking these exams quite comfortably.
Yeah. And Anjana, it's been a long time since you graduated from college, and we all have that imagination of college, na
Hmm.
expectation of college. For me, when I'm studying in my third year and I
Hmm.
transitioned into college, I had this big imagination for colleges because I grew up watching Bollywood films. So I had this imagination of college, that what college life will be like. So I want to
Hmm.
ask you on that. Though it's been some time since you graduated from the dental college, I would like to take you back and request you to talk about your college life, and in an academic point of view, how hectic it
Okay.
was, and was it the way you imagined?
Hmm. So, as I mentioned before, my first choice was MBBS. So, frankly
Yeah.
speaking, there were no dentists at home. So I had no idea, no clue what to expect from dentistry. So I was a completely blank page when I entered college. So that was it. And as soon as I entered college, dentistry BDS is a 5 year course, just like MBBS. MBBS is 5.5, but BDS is 5 year course where you have 4 years of study and one final year of internship. So the first 4 years was studies, and frankly speaking, I didn't know there were so many branches in dentistry before
Yeah.
joining BDS. Because we have so many clinical subjects, so many non-clinical subjects in dentistry that I had no clue of before joining. So once I joined, it was like, abhi kood gaye, you have to do it, right?
Yeah.
So it was like that. And the first year definitely was challenging because in the first year itself you have anatomy, which is a very important subject. And that subject will be relevant even to this current day of practice in dentistry. If I'm practicing even after 15 years or say 20 years into dentistry, your still anatomy has to be very strong. So anatomy is one subject which they put you in the first year itself. And that, for all the aspiring dentists who are listening to me right now, I would say please take your anatomy seriously, because when you're practicing in dentistry it is very much important. And when we're studying anatomy, we are studying only the head and neck region, so it is not very elaborate as for MBBS people. But it is definitely a very important subject to concentrate on. Anatomy is one subject that you need to concentrate on. And when it came to final year, that is the fourth year of dentistry, we had, like total 7 subjects. We had to give exam for 7 subjects. And usually in medical field you don't get, 2 days break for each subject or 1 or 2 days break. It is continuously for 7 full days. So definitely giving exam for 7 subjects was hectic, but then it was equally rewarding. That is the period where you study hard, you prepare yourself for your future profession and things like that. So it was definitely amazing. I mean, the study, academic wise, it has been great. There are a lot of challenges that come in between, like, I'll just give a brief here as to what is dentistry basically.
Yeah,
When
sure.
they say, when you enter the dental college, the first thing that they explain to you is what is dentistry. When they give you the definition of dentistry, it is called the art and science of oral health, and etc etc etc. So we dentists are not just doctors, we are artists, because
Artist.
it involves a lot of skillful work. Your hands need to be skilled, so definitely they train you for that. So it is a combination of art and science. It is not just being a doctor or whatever it is, because we're directly dealing with live patients who are very much awake, and they can see you, and they can hear you, they can feel you what you're doing. So definitely it is that way, it is very rewarding. And to this, they train you academically and also practically during your degree course.
So this is college, but how can a person himself or herself can
Hmm.
train for dentistry? Because as you said, you mentioned that you were clueless before getting into the college, and
Right.
anybody who's now facing the same problem, and he or she is clueless about transitioning into college and just got on the college part, how can she adapt to the changes?
Okay. So, first thing is definitely, you need to make peers, the peers around you, they're going to help you out. And you have your seniors in college who will help you in, in that transition when you've joined any new college for that matter, not just in dentistry. I think in any field of study, you will have your seniors, your peers, your staff, the teachers, they all help you, but having that strong will to adapt is also equally important. So that way you can definitely transit, and you can have a nice experience of your college life.
So it's all about building connections and getting to know people
Definitely.
better, and that helps a
Yes.
lot.
Yes,
So
definitely.
yeah. As you mentioned, Anjana, the syllabus, the subjects you liked and disliked also, like you mentioned anatomy being the core
Yeah.
part of dentistry. I want to
Hmm.
ask you, was there any subjects or book in BDS which you love and still feel like referring to, and why?
Okay. So definitely, as I mentioned, anatomy is something that I definitely will go back to even during my practice. There is one book of Mr. B.D. Chaurasia. I think every dental student, it's a Bible for them. Like every dental student has that book, B.D. Chaurasia's Head and Neck, Volume 1. And there is one more book that I personally refer to sometimes, even during my clinical practice, is Malameds. Malameds is for anesthesia. When you're practicing in dentistry, it is a routine practice to give anesthesia, local anesthesias, and all that. So definitely Malamed is one which I refer to. So these are books which will help you even in any field of dentistry for that matter, because any field of dentistry has anatomy, has oral surgery to some extent, and most of the graduates who do practice after BDS, and they don't pursue anything further. You have a lot of BDS graduates who have their own clinics and who work in hospitals, so they all require these general dentistry skills, and these two are my personal favorite books which I go back to even now.
Anjana, you mentioned that the career options people have, like BDS graduates,
Yes.
some people go to open clinics and some works at hospital. Even I was researching when, so I found a profession of a dental scientist. So there are a lot of career options also. So can you
Correct,
please
correct.
elaborate on the career options one get after the BDS graduation?
Yeah, sure. So here we have two broad categories when you can speak about career options after BDS. It can be either in the academic line, or it can be in the clinical practice line, right? So in the academic line, if you go, you can become a lecturer, a professor, and then you can assistant professor and professor, and you can become a HOD, and then you can even become the principal of a college. I mean, that is definitely a long process, but that is how it progresses stage by stage when you get into academic line, as in any other profession. Yeah. But when it comes to clinical practice, there are n number of options for dentists. So what I have personally seen is that majority of the students, once they have cleared their BDS, they get into masters to do their MDS. So in MDS, you have lot of options. You have totally 9 subjects from which you can choose your masters. Few of them are clinical, few of them are non-clinical subjects, and you can pursue a masters in dentistry. Now, if you don't want to do your masters in dentistry, slightly deviate, then again you have different options. You can get into, there's one more very popular choice that we see these days is MBA in hospital management. Okay, a
Yeah.
lot of people pursue MBA in hospital management when they don't want to get into proper clinical dentistry job, and they get into administration, hospital administration, and things like that, and insurance, and they deviate from dentistry. If not MBA, then you even have this PG diploma in health and hospital and healthcare management. That is also a possibility, and this also opens up the same avenues, just like MBA in hospital management. So this is the second option. I have also seen a lot of BDS graduates who get into MPH, that is Masters of Public Health. So
Yeah.
they can start working with organizations like WHO, UNICEF, and they can work for the betterment of the public health in general. Okay, so that is one more option. And then you have a lot of options post MDS. If you want to further study, you can get into some fellowship, and that will narrow down your area of expertise. We have very less experts in dentistry who have such great expertise. You can get into fellowship in oncology, fellowship in trauma. So there are a lot of things. So that is one more option. After that, you can also get into medical research. Okay, that is one more field where you can where VDS graduates can try and dwell into. That will open up a different avenue where pharmacology also adds up in this particular
Yeah.
field of medical research. You can work with big these medical drug companies, and you can act work as a medical transcriptionist, and you can take part in the research of developing new drugs or new medical equipments. So that is one another field of dentistry that they can explore. There is one more option of dental. There is something called as cosmetic dentistry, which is highly booming nowadays, where you are exclusively into you may have heard about people telling that they got a smile makeover, they got aligners and
Yeah.
things like that. So that is again a very booming field in dentistry, where they can get into cosmetic dentistry. Nowadays there are even courses which help you out in opening a dental along with a hair care clinic. Okay, where they do take up a hair transplant and things like that, but that is again a slightly deviated one. But you have degrees which will help you in that. Another option is forensic odontology. That is slightly very in the it is still taking baby steps in India, I would say. Forensic
Yeah.
odontology is not very big in India as per se, but there are courses which offer forensic odontology fellowship programs, 1 year fellowship programs. So that can be pursued by BDS graduates if they want to get into, if they're interested in this particular field, they can even do that. Apart from that, if you have this entrepreneurship kida, okay, for
Yeah.
somebody like me, okay, I am someone who is wanting to be an entrepreneur in future. So if you're somebody like me, you can, then sky is the limit for you. You can get into entrepreneurship in any field for that matter. So currently I'm doing in nutrition, so that definitely that is an option open to you guys. So yeah, there are n number of options which open up for any BDS graduate. And if you want to just go into core dentistry, or if you want to slightly deviate and stay in the medical field but still want to do not core clinical job, and you don't want to go through the pressure of that clinical practice, because as doctors in India are under extreme pressure, work pressure.
Suppressed. Yeah.
So yeah, so if you don't want to get into that, then you definitely have other options where you can work. So yeah, there are a number of options. Sky is the limit, I would say.
So Anjana, now you're professional and you know such fields. But when someone is in college, he or she usually worries about career, and there's a lot of pressure in them, what to do, what not to do. So
Yes.
coming back to your college life, I want to ask you
Hmm.
that back in those days, how concerned were you and your peers about your career after college? And did you discuss whether you wanted to get a job or start a clinic?
Yeah, definitely. I mean, as with any graduate for that matter, we were definitely more concerned. We were very concerned as to what next, because you I personally was not very sure on what next to be done, because everybody was trying to give, neat MDS, and they were trying to do give the entrance exam for their masters. But I didn't somehow want to do it at that point of time, and I didn't want to fall into the rat race of, doing
Yeah.
MDS immediately after my BDS. No, I didn't want to do that. So definitely I was concerned, and me and my friends would definitely discuss. We would have, long discussions. During the internship days, we plainly see, matlab, we are only concerned with treating the patients, and for the entire 1 year you're only going to treat the patients as a, as you treat outside in a private practice. So being in GDC, we used to have n number of cases, and we used to be very busy, and in spite of that we used to discuss कि आगे क्या करना है, आगे क्या करना है. So then, we did consult a lot of seniors, and we were discussing कि ये options है हमारे पास, ये कर सकते हैं. And one more option I forgot to mention previously was that, a lot of people, even in my batch, a few of them even, they pursued their degrees in foreign countries, like for somebody in
Yeah.
Europe, in Australia, and US. You have their own licensing exams and qualifying exams which you can give, and you can start practice there. So that is one more option which opens up. I think nowadays a lot of dentists want to do that. So young graduates, they try and give their qualifying exams, and they start their practice in different countries. So definitely yes, we were discussing, and I would suggest the young graduates who are listening to me, during your course of internship, do not waste your time. If you have in the evening time, please go have some, they work as a locum in a nearby dental clinic, get some
Yeah.
real practice in the dental clinic in a private setup, because what you do in college is different from what you do in a private setup, because it's completely different worlds. Here in college you have the support and the security of your staff, but in private practice that doesn't happen. You're on your own. So definitely get that experience. Definitely work in an evening, during the evening hours or on Sundays when you have time. Practice in your in any clinic nearby. Approach your seniors and work. That is what I would say.
Anjana, you mentioned the internship days, your internship days and college days. So in
Yes.
college, people used to like study books and academically excel. But
Yes.
how is it different from the practical experience you gain in the internship part? And
Yeah.
how did you transition into becoming a dentist, and what challenges you faced while the internship you're doing?
Yeah. So I would say the current. I'm really not very sure about the current, academic, this thing, the syllabus and what all is there currently. But when I was there, we didn't have implants in our matlab in our studies syllabus, right? Implants was very native when we started off. So currently implants is the thing in dentistry. Everybody is practicing implants, everybody is practicing cosmetic dentistry. So these things are not very much in detail in your graduate level of studies. So when we come to and also root canals, that is something that is done day in and day out in dentistry, general dentistry practice. And that exposure was not very much when we were in our internship. Of course, being in GDC, we had a very good patient inflow. We had around 200 OPD per day. That was the, in influx of patients we had. In spite of that, we didn't get to do many cases. I would say we could still have done better during our internship days. So once you do that, you get a hang of how things work in the private clinic, because private setup is completely different. In the sense, here you're on your own. Matlab patient ko agar kuch galat ho gaya, and nowadays patients are very educated. Before coming to you, they would have done complete research on Google. Okay. And they know what treatments are available, what options are available, and if you cannot match up to that knowledge of the patient, then it becomes a problem. So that is where the difference lies in private practice and in internship. So getting that private practice definitely helps you. That transition takes time. Mistakes hote hai, but it is okay. You learn from your mistakes. But You need to continuously keep improving yourself. That is how it works.
A fun question, Anjana, when a patient comes to you and he has Googled everything and he only knows that what has happened to him.
Hmm.
How do you deal with that?
Okay, this is actually, this has happened many times. I mean, I would not say this has not happened before. In fact, this happens majority of the times where the patient comes and says, "Doctor, this I'm having a toothache here. I feel you should do a root canal." I mean, they just assume कि हाँ root canal ही
Yeah,
करना है इसको. That is what their assumption is. But then they don't know that there are a lot of options available. If I mean, it depends on the depth of the caries that has happened to the patient. So first thing is, we say, let us first examine, let us first do what it is, let us first see what it is, then we will give you different treatment options, and if you feel it is right, then we can go ahead. But please do not insist on the same treatment that you have thought about, because they are not doctors, they're not qualified doctors, right? And Google can definitely mislead you at many times. That has
yeah.
happened. So definitely we will try and counsel them. We will tell them ki this is not the way, this is the way, these are other options available. So listen to us. And once, so that is why I say, one more major difference I would say, in internship and in your private practice, is that communication skills matter a lot. Because somebody is coming to you, you need to try and explain to them what is wrong, what are the treatments available with you, and you need to convince them to get the treatment done from you. So that is an art. It cannot be done just like that. I mean, so that communication, developing your communication is very important. So that also students need to work on. If you are someone who is very introvert and who doesn't like to talk to people, you start slowly by talking to your peers, talking to your seniors, and make it a habit, because communication skills go a long way.
I totally agree on the Google part because once I had a chest pain and Google convinced me that I'm having an heart attack. So
Heart attack, yeah.
I totally
Right,
agree
right.
on.
So yeah.
But coming on the college part, I wanna, as we talked about internship, but is there
Huh.
a concept of placement in BDS college? Because in my college, once I am graduated, like 4 years, so campuses usually comes in the seventh semester only. So is there
Right.
a concept? Do private company also hire BDS graduates?
Uh, See, again, it depends. Frankly speaking, there is no concept of placement as such in any medical college, I would say. I think I can even speak for MBBS if I'm not wrong. So I don't know if I'm wrong, kindly excuse me. But there is no placement concept as such in BDS colleges. That is what I know of. So once you're done, you start looking for options where you practice under some senior, and then you transit into the next stage, either your master's or your own clinic, or your excuse me, or pursuing something else that you want to do. So there is no concept of placement as such, but definitely you can get help from your seniors or from your staff who have big setup clinics. And there are a lot of private companies, the private dental chains that you know of. There is something called Clove Dental Chain, then Sabka Dentist is there, Star Dental is there. They have their presence across many cities, like 26, 28 cities across India, not just in any particular state. So definitely they have vacancies for dentists. You can go and approach them directly, and you can apply for them, and if things work out, definitely you can start working with them.
So it is all about the person, and he has to be cautious that what is happening around him or around her. So he has to be
Definitely.
attentive all the time to what
Yes,
I am
yes.
doing and what I am doing. I am doing in the rest of the years to come.
Correct, correct.
So, my next question, Anja. After college, you also worked as a dentist about 4 years. And how was
Right.
this experience in terms of personal and professional financial growth also?
Okay. So I worked under a very senior dentist here in Pune. So as work experience, in the sense of learning, has been great. But I would say, you get to see, it was actually a hospital setup, dental hospital setup, which is not very common in India. So that was one good thing that I got exposed to. But I would say that when you're working under somebody or some senior, it is always, they are very skeptical of their name and reputation, because they have taken years to build that reputation and name. So it is not like you go and they give you all cases to start doing immediately. No, that doesn't happen. They first observe you, they train you, and then they give you cases, right? So you need to have that patience when you're working out initially. But then personally I would suggest ki if you're planning to have your career in dentistry itself, it is any day better to have your own practice, because the number of cases and the type of cases when you work under somebody gets limited after a certain period, right? There is a stagnancy in growth. I mean, that doesn't it's not like they can give you every single case that comes to you. So I would personally suggest that work for a few months or a year or two maybe, and then have your own practice, or next whatever is your career trajectory that you want to take up. So you can go ahead and do that. So financially I would say it was actually very bleak. I mean, I was not personally very satisfied with that. So I feel that if you want to make money in dentistry, have your own practice, or pursue some higher studies and something which is, as I mentioned before, the fellowship programs that you can do, where you become a super expert in some particular field. For example, I have a batchmate of mine who is has done two fellowships in oncology, and he is now an expert in head and neck cancers. So there are very few experts in head and neck cancers who can do surgeries for that, and things like that. So you become a expert in a particular field where people will call you for the treatment. You can do that, so that will help you out. So that is how you can expand, and you can increase your growth in dentistry.
Anjana, you mentioned working under someone. How has
Yeah.
that experience been? That has it been instances where you felt like, am I doing the right thing, or you doubted yourself? And how do you like motivated yourself in that point of time?
Uh, I wouldn't say I doubted myself as to what am I doing, because there was definitely learning involved, and I definitely improved how to communicate to a patient, because that is something you learn by practice, right? So talking to different kinds of patients, you don't have one type of patient, you have many patients. We learn that there are different types of patient, some who are easily convinced, some who require a bit of explanation to get convinced, some पेशेंट्स आर सच दैट आप कुछ भी कर लो कुछ भी बोलो उनको अपना ही चलेगा. ठीक है. So
Yeah.
you have different types of patients, and you learn to deal with different types of patients in that phase when you're working under somebody, because you are observing, your eyes, your ears are open all the time. So you're observing how they are dealing with patients, you're learning, you're listening to what they're trying to say to convince the patient. So definitely that helps. I mean, that is one thing that I learned very well when I was working there, how to talk and convince. And also in the procedures, when we are doing certain procedures, if you're going somewhere wrong, they come and correct you, they come and tell you this is not this you need to slightly deviate and do it this way. So definitely they are a helping hand. But I wouldn't suggest this in a long run, not more than 2 years, I would say.
Yeah. Every boss is like that, huh? Correcting his. Yeah,
Right.
Andra, I want to transition into technology, and as I know that once the time you started, the technology
Hmm.
was not that advanced, as you mentioned the root canal.
Yeah.
So, as technology impacted the field of dentistry nowadays, how do you see that the differences between your time and now?
Definitely, there is a huge change in terms of the type of treatment given, the time required for any treatment. Nowadays, you may have heard of the time one day dentistry. In the
Yeah,
morning, the patient comes to you, he gets all the diagnosis and the x-rays and everything done, and the dental units are so well equipped that the patient can finish his treatment 3 4 hours in the dental clinic, and by afternoon the patient is free to go with his teeth fixed. That is one day
yeah,
dentistry that is practiced nowadays. So that is amazing, because we when we were in during our internship, we used to take 3 appointments for one root canal. And that, compared that to this, nowadays you finish your root canal, you finish your crowning, everything in half a day, and the patient can leave the office. So that is there. And as you say, AI is there everywhere. AI is was there in dentistry, is improving dentistry day by day. So what happens is, in dentistry, there has been use of AI in the form of CBCT machines, in the form of, so it helps in better diagnosis, it helps in better treatment planning. Because what X-rays we used to take before, nowadays X-rays has become really obsolete. So X-rays, the ones which we used to take before, take an X-ray, develop it in the using developer activator, that is just gone nowadays. Nobody does that. So that developer activator concept is completely gone. The X-rays that we have is a 2D image. Now when you go for a CBCT, it is a 3D image of your tooth and the root structure and the bone surrounding the tooth. So definitely it helps in the diagnosis. It also helps in, treatment planning for your cases. And we have some nowadays, even I have seen many clinics where they don't even use impressions anymore. We have to take an impression of the tooth which we are treating. So nowadays there is impressionless treatment, because we have intraoral scanners which have come. And these intraoral scanners are definitely, part of the AI technology that has come up. So intraoral scanner, you just move, it's like a pen sized device. You can just move it around the tooth, around your oral cavity, and you can just get the exact image in the exact dimensions of your tooth, and everything, and it can immediately give you what kind of crown can be put on this tooth. So that is how AI has revolutionized dentistry. So definitely there is a lot of innovations that is happening.
Thank you for all the insights, Anjana. We'll be moving forward from the BDS section. So, one last question for BDS. I want
Yeah.
to ask you that thousands of students with lofty dreams go to BDS. What message would you like to share with them?
Okay. So BDS dentistry is a beautiful field to get into, no doubt. But we had an anatomy professor. Okay. Hearing anatomy again and again, anatomy is my favorite subject.
Yeah,
So the
can
thing
see.
is, yeah, we had anatomy professor. So sir would say that in whatever field you are, not just dentistry or BDS, I mean, he was talking in general, try to be the top cream, like 1 to 3%. If you're in that top cream of the layer, you are going to excel in whatever field you are. So dentistry is definitely a very rewarding field, both professionally and financially. So if you want to take up, and if you're somebody who is very keen in that, definitely go ahead and pursue it. uh, Sky is the limit. I mean, you can make your career.
A quick fun question, Anjana. I want to ask you that when in your college, were you a front bencher who used to listen to college professors all the time, or you were a back bencher and used to bunk classes and all that?
Fortunately, unfortunately, I don't know. I was a front bencher.
Yeah, I can
Yeah.
feel that.
So
When you
no,
mentioned the
I
college
regret it
professor,
now. I regret it now because
why?
no, because see, I am as you know that I am also pursuing my masters in nutrition currently. I mean, I'm in my final semester now. So definitely, I mean, I regret it because it's not like कि जैसे देखो, they say na कि front benchers are the one who score really well and they do really well in their life. It's not like that. Backbenchers, they're brimming with ideas actually.
Yeah.
A lot of a lot of my batchmates who were the backbenchers, they're doing excellently well in their practice right now, and many of them have deviated also, and they're doing well in their own fields. I mean, it's not
Yeah.
like backbencher, frontbencher. No, it doesn't make a difference because they have their own set of my ideas, and they excel. That's it.
Let me just tell you, Anjana, you have gained a lot of backbenchers fan base just right now, just by mentioning the sentence. Yeah, moving forward, you mentioned, Anjana, that you are pursuing a master's in nutrition. So my next question will be on that. What made you
Okay.
reconsider your career path as a dentist and switch to nutrition?
Yeah. So, as I mentioned before, I wanted to be an entrepreneur. So that kida, got into me, and I wanted to do something on my own. And food, I wanted to do something in the food industry, basically. So then I was suggested that it is better that I have some. degree in this so that I can, do a better job at it. And that is how I got into masters in nutrition and dietetics. But my specialization is in food safety and quality management. So I didn't want to get into clinical nutrition, but I got into food safety and quality management. That is how I landed up in this field.
Food safety in college. So, another fun question. Sorry, is chocolate eating safe?
Yeah, I mean, see, chocolate eating is safe, but provided you also take care of your teeth. It is not,
Yeah.
see, always it happens that, people make chocolate the culprit. They say chocolate khaya, that's सारे मम्मीज ना यही बोलते हैं अपने बच्चों को कि चॉकलेट खाया दांत खराब हो जाएंगे, अभी डॉक्टर डेंटिस्ट के पास लेके
Yeah.
जाना पड़ेगा, सुई लगेगी, ये वो एंड ऑल दैट. नो, इट इज नॉट जस्ट चॉकलेट, but I would say, it is definitely any food item that gets stuck on your tooth, be it biscuits, be it wafers, any savory snack as well that can, get stuck on your tooth can cause caries. So it is not just the chocolate. Bichara usko itna, sabne bura kar diya hai. But definitely, yeah, that is it.
Anjana, being a mother and then being
Hmm.
a dentist also,
Hmm.
so how does that fit in those two things? Do
Uh,
you like have any restrictions for your children? Like, do not eat that or do not eat that?
No, I wouldn't restrict my kids. I don't do it even now. But it is just that I would encourage them, even for any kid listening to me. I mean, I don't know if kids are listening to this podcast, but so if you're eating anything sticky, as I mentioned before, like eclairs khaya, ya fir kuch bhi that can get stuck on your tooth surface, make sure you eat something raw, like raw carrot or raw cucumber. That is, eating the raw salad is as good as brushing your teeth once. So, it'll naturally cleanse your tooth, and if there is anything stuck on your tooth, it'll help and cleanse it out. If possible, brush your teeth. That would be the best advice, but that is not possible. So, I say the same thing to my kids as well.
Yeah,
So, if you're eating anything sticky on to your tooth, make sure you eat a salad. उसके बाद थोड़ा salad खाना compulsory है, तो वो खा लेते हैं. So then no need to restrict them.
yeah. So, being on the same topic, can you shed some light on the relationship between nutrition and oral health?
Yeah. So nutrition, see, again, I think post COVID, everybody has, increased interest in knowing about what to eat, what not to eat, because that was one eye opener for everybody. So having a balanced diet is very important, not just for your oral health, but for your overall well being, right? So oral health is no exception. When you have good nutritious diet, and we say include rainbow in your diet, right? That means have at least 4 to 5 servings of vegetables and fruits combined together in a day, different colors, taki each color, it is because of certain micronutrients that is present in the food. So that will help you give all the required vitamins and minerals needed for your body, and it will also keep your oral health perfectly fine. So avoiding sticky foods, avoiding foods that can stay longer in your oral cavity. And I would, very importantly stress on the fact of night brushing, which majority of us don't do, because
Mhm,
night
yeah,
brushing is very important. So I would say that will help you maintain your oral cavity in a very good shape.
yeah. So, Anjana, moving forward to your nutrition journey, let's
Yeah.
also talk about your masters of nutrition journey and what career option this opens up for you and people who are studying this.
Okay. So basically, nutrition may you have again a lot of categories in nutrition. You can get into clinical nutrition. You can, get into public health nutrition. You can get into food safety quality management. Another upcoming field in nutrition is sports nutrition. You have nutrigenomics. So there is again a wide array of options available for nutritionists and dietitians who want to pursue this field. So I myself am pursuing in food safety and quality management, where we will be, working with FMCG companies, the fast moving consumer goods company like Nestle or ITC or, Marico, companies like this, where we'll be concerned with dealing with the quality checks of the products and the production process, how well they are maintaining the food safety, because ultimate aim of any MNC FMCG company that is working is to provide healthy and safe food to a consumer, right? So in this scenario, we are helping those companies to maintain that procedure of maintaining good safety precautions and the personal hygiene that the workers need to follow, so that we get good quality food on our plates.
Anjana, I want to know your initial thought before transitioning to being a nutritionist. I want to ask you that what was that initial thought that made you make this transition?
Yeah, so as I mentioned before, I wanted to, get into entrepreneurship in in food industry. So when I was looking for different options, it was my husband who suggested that, because having a degree in that will definitely open up new avenues for me. And my thought process was, what will happen? I mean, will I fit into it? Because I was again studying after a long gap of almost 8 years. So that was again, a big question mark for me. Like, will I be able to do it? Because it was a full time 2 year course that I picked up in Symbiosis University in Lovely campus. So it was definitely challenging. I had my own doubts, but once I got into college, it was, I think, I would not say a very smooth ride, but it has definitely been a rewarding one.
Anjana, you mentioned the entrepreneurship part, that is your future aspiration. Can you please elaborate on that, on what you meant by that?
See, in entrepreneurship, initially that was my thought process before getting into, excuse me, before getting into the master's degree. It was, I wanted to do something in the, you guys would have heard about this lakdi ghana, because when I was seeing that during COVID as well, there was a lot of buzz going on about healthy eating, healthy diet and everything. So the oils that we are consuming, a few of them, they have highly processed chemicals in it, and they use a lot of chemicals to process the oils to make it edible, and things like that. So I was exploring things about lakdi gana, that is, cold pressed oils basically. So I wanted to get into something like that, but then after joining the field and getting to know more about it, this has definitely opened up new avenues, and now I am someone who is keen on reducing food waste as well. you know so I have aspirations in reducing food waste and reducing plastic problem, and I want to combine these two and work something. But I don't know how far it will go, but I definitely hope something will come up.
Yeah, that's a step everybody is excited for. Like, we hope you get that. And
Thank you.
this is my last question for you. Any messages for the people who want to pursue career in nutrition?
See, career in nutrition again is a very upcoming field right now, because lot of people are interested. If you are in a family gathering or if you are with your friends together, I am sure there is no day where, no event which passes on before somebody starts up a topic on how to eat healthy, how to be healthy, how to do proper diet, how to exercise, things like that. So it is there in every household, and this is the time to be in nutrition field, I would say.
Yeah.
This is the period. So you can start off your journey with your bachelor's as well in nutrition, because my bachelor's was in a different field. But definitely you can take up your bachelor's also in nutrition, and you can pursue it further.
Yeah. On a fun way, I can say that it has to be my mom who wants to talk to you like on nutrition, because she always has something to talk about it and what to know. But
Right.
her way of nutrition is to get plump. That's all she
Hmm.
wants. That her
Right,
kids to be
right.
plump. That's all. So thank you, Anjana, for all your time. And there you have it, folks. This incredible live session with Dr. Anjana. And thank you, Anjana, for being here with us and talking to us. It felt great, and we learned so much from you. And we're proud of you in a way, because you're contributing so much to society and managing all that stuff together. Thank you. Thank you so
Thank
much for it.
thank you, Aman. Thank you for having me. Thank you, Coach Minister, for having me on this podcast. Thank you.
Okay. See you, Anjana.
Yeah, bye.